So I want you to imagine that you just picked up a book and you started reading, and suddenly the center of every single word starts to blur. You blink, you adjust the light, but no matter what you do, it just won't clear. That's exactly what happens in age-related macular degeneration, or AMD, which is the leading cause of central vision loss in older adults. AMD never causes total blindness. Side vision remains completely intact, but you lose your central vision, and it makes it super hard to read, drive, or even recognize faces. The macula is the retina's bullseye. It's packed with cones for sharp detail. In AMD, this high definition zone is damaged. Early stages can be completely silent, but if it's a later stage, you can have irreversible vision loss. There are two types of macular degeneration. There's dry and there's wet. In normal eye, you should have clear vision. In dry, you have this sort of fuzzy, distorted vision. And in wet is when you lose the center of the vision field. So dry AMD makes up about 85 to 90% of all these types of cases. And there's waste buildup under the retina, which impairs the retinal pigment epithelium. And over time, the macula starts to waste away. And this is called geographic atrophy. And this causes these little blind spots, but this is something that progresses rather slowly. Wet AMD is only about 10 to 50% of the cases, but this is one of the main cause of severe vision loss. Here you have fragile choroidal neovascularization that grows under the retina, and these vessels leak fluid or blood, and so this can cause swelling, hemorrhage, and even scarring. Vision loss here is really rapid. And in case anyone was wondering, yes, dry AMD can progress to wet AMD. This can happen at any stage of the dry AMD, and it's important that when you have dry AMD, you do routine eye exams to monitor for any sorts of changes. And wet AMD normally does begin off as dry AMD. So one of the biggest risk factors for AMD is just being over the age of 55. That's your strongest factor. Sure, there are some genetic variants like in CFH and ARMS2 or the HTRA1. These do increase susceptibility of getting AMD. Smoking can double or even triple the risk of getting AMD and definitely does accelerate the progression. And in terms of race, it's more common or seen in Caucasians. In terms of systemic health, there is a high risk associated with hypertension, high cholesterol, and of course, obesity. And so the diet recommendation here is the Mediterranean style diet. It's considered protective. So if you have a diet that's low in leafy greens, lacking omega-3 fish, this raises your risk significantly. In early AMD, these patients are often completely asymptomatic. But if we go a little bit further down the line to intermediate, these patients do have symptoms. They have subtle blur in their vision and poor low light adaptations. In late stage AMD, these patients tend to have something called metamorphosia, where straight lines begin to look really wavy. There's central scotoma that I mentioned before, where there's a darker blind spot in their vision. Colors fade, reading and face recognition really does suffer. And again, peripheral vision is completely intact the entire time. A simple test that you can do for this is called the Amsler grid test. So this is the Amsler grid, and if central lines look bent or if they look missing, then that definitely does raise a few red flags. In terms of diagnosis, you can do a dilated eye exam, and this is with the use of special eye drops to widen or dilate the pupil, and this helps you get a better view to the back of the eye. You can do an OCT or a optical coherence tomography, and it's pretty much non-invasive imaging test, and it gives you details or cross-sectional images of the retina and other eye structures. And lastly, you can do fluorescent. It's a dye study highlighting leaky vessels, and this is really helpful for wet AMD. And these tools catch disease early and, of course, help guide treatment. So currently, there's no cure for dry age-related macular degeneration, but there are treatments that are available, and I'll get to that in a second. Firstly, I want to talk about lifestyle measures, right? So this is don't smoke, this is eat your leafy greens, control your blood pressure, and for an intermediate stage, there's a formula, the AREDS2, which includes vitamin C, vitamin E, zinc, copper, lutein, and these slow down the progression of AMD by 25% over the course of 5 years. So this is one of the first drugs approved for treating dry AMD in the US, and this is pegcetaclopan or Syfovre, which requires monthly or bi-monthly injections into the eye. Syfovre is a complement inhibitor specifically indicated for the treatment of geographic atrophy, which is a severe form of dry AMD. It works by targeting the overactive immune response that damages the retinal cells. In wet AMD, the first line here is anti-VEGF injections. This is your ranibizumab, aflibercept, and bevacizumab. And these are given monthly or bi-monthly. And what these do is that they block abnormal vessel growth, and they end up preserving vision in about 90% of patients. For geographic atrophy, there's new drugs like pegcetacoplan, which are complement inhibitor, and it can slow lesion growth, even though it doesn't fully restore vision. There's low vision rehab like magnifiers, special glasses, and training help patient adapt when vision loss is really significant. So in terms of research and outlook, there are emerging therapies like stem cell transplants to replace the lost retinal cells. The field is moving pretty quickly, but prevention and early detection still remain absolutely key. So for patients and future physicians, it might be worth it to quit smoking, eat your greens, exercise, and maybe get regular eye exams. So AMD may be common, but with early detection and today's therapies, we really can protect central vision loss and preserve your independence for your patients. So thanks everyone for paying attention. Here are my references.